It is a pleasure for me to be here in front of you to share with you our emotional work that we can make in Puerto Rico with our transgender population. I have no financial interest to disclose. The objective of my presentation is to demonstrate the elements needed to implement a trans-centric clinic and summarize priorities identified by the transgender community to engage in HIV status-neutral prevention and treatment cycle. For you to have a little bit of our center is in the Caribbean. It's a nonprofit institution founded in 2001. And our mission is to provide access to a comprehensive community-based primary care, mental health care, in a biopsychosocial model. Effective interventions are needed to empower transgender population in Puerto Rico and retain them in care, especially transgender women. Most clinics in Puerto Rico that provide health care services to the transgender community lack well-trained, knowledgeable, and sensitive staff in transgender topic. Centro Ararat sought to address this gap within an existing multidisciplinary care setting. In February 2016, Centro Ararat launched a pilot project focused on transgender female. We started with 20 trans females and was successfully accepted by the trans community. And we said, would it be possible for us to transform this project to a full trans-centric primary care clinic? And we did it. Our project has 4 phases: the outreach, the development, formative, and incentive. And I will talk a little bit about each one. The outreach phase, from February to June 2016, with 2 different approaches: the individual ones, the one word of mouth, and the private home parties, like Tupperware parties. The development phase, the creation of a trans-centric safe haven site, a harm reduction educational component was also integrated as a biosocial model. We want to make a safe space when the population feel in a trusted way liaison with our healthcare professional. And we mention it as a safe zone. The formative phase, we started with different workshops, from the militancy one, the clinical one, the social one, and how to prepare them to go to a job interview or to express in the community as empowerment women. The educational curriculum included those topics that I already mentioned, but also the theories of gender and power and motivational enhancement. Formal assessment was performed after the 3rd phase because we have to reassess if we are doing the right thing. And what a better model when we ask our participants to know if we are doing a right thing. We have an incentive phase. We provided incentive to keep the participants engaged in the clinic. We gave gift cards, and the primary service cares were free for the first 3 months, and then at a discount price. We included the nutritionist, psychologist, myself as a primary care physician, the navigator, counseling in PrEP, and STI management. And the results were as this. From 20 participants, we already have 173 participants, and you can see here that most of them are trans women, followed by trans men, 35, and non-binary. This is the gender identity or sexual orientation that they self-claim. Most of them refers to themselves as heterosexual, then fluid, and then bisexual. Here you have the universe. In terms of the age, most of them are from 25 to 34 years old, followed by 19 and 24. The oldest one is 72, started when she was 69, and a trans male started at 62 and now is 63. Started with us in the transition. In Puerto Rico, we have a law that younger people we cannot manage or prescribe hormonal therapy because I'm not a pediatrician. And so we have a special informed consent regarding patients that are 18 and 20, between 18 and 21. They have to be consented by their guardians or parents, legal parents. Here you have that most of them has high school, and some of them are postgraduate. I have one that was working with us as a registered nurse and moved to USA to study medicine. Here you have that most of the trans men are employed, followed by the trans women. We have 30% of them that work in sex for commodities, and we mentioned it because we want them to be as healthy as they can. We offer them a proper management for prevention, condom use, dental PrEP, but also with the navigator and the psychologist how to negotiate in their sex work ambience. Most of them are using hormonal therapy, but that is the focus of their engagement there, but it's not the only topic to be there. They want to feel like they are in a community, and they want to go to a place that they can be themselves. As I mentioned, we have a multidisciplinary clinic that include different specialties. We have people living with HIV or people with HIV, because this will change. And we mentioned that we are continuing in different workshops because that is one of the engagement areas to continue to serve them in this route of their transitional journey. As a conclusion, our transcentric approach within our primary care model, we use the biopsychosocial comprehensive model, one-stop shop. So the participant go there to the nutritionist, also to the physician, talk to the case manager in the same day. We try to do that because sometimes, and as you know, the transportation is an issue. Another thing is that we model an HIV status neutral clinic, so we don't talk about HIV at all in our translucent clinic as a specific topic. We mention it as a preventive topic, as other kind of topics, diabetes, hypertension, etc. And if the participant is HIV negative, they will enroll in this route of prevention approaches, such as PrEP. And if it is HIV positive, we enroll the same day most of them, if we can. We managed to do the test and treat, so diagnosis and engagement to care, and linkage to care. Meaningful involvement. For us, this is the best one. We cannot do anything for the trans community if they don't do their thing. So we ask them what they need. We encourage them to work with us. We already have 6 participants that work with us in different kind of roles. We have one in a planning council of the HIV, in the community advisory board, in the quality team in our clinic. We have the honor to be funded for SPINS named TWEET, so it's engagement and linkage to care for trans women living with HIV. And we encourage them, and they are participating in the Governor Advisory Council in topics related to LGBT community as the umbrella: anti-conversion therapy law, anti-discrimination law, cultural sensibility compulsory educational credit, that since from 2020, the healthcare professional has to take 2 compulsory credits in cultural sensibility. In personal professional development, we encourage them to finish high school if they don't do it. If they want to continue in the college, or if they want to change line of work, such as sexual worker to other kind of work, or they want to be from voluntary to an employee in our institution, we manage to help them to do that. We encourage them, and we included them in different kind of educational forum, nationally and locally, for them to be engaged and have empowerment, because that is the focus of our clinic, for them to be empowered. And moving trans forward, when we prepare the ambience, we have different kind of posters, and this is one of them. Eres nuestro orgullo. We are proud of you. So other thing is that the ambience of the clinic is very humble, but a lovely one. We have open houses, pizza party houses that we mentioned it. This is one of the pictures of the end of one of the workshops. The clinicians always participate in those workshops, so at the end, the participant, we have gained trust in them, and they can tell us the things that they need in the biopsychosocial model. This is an example of a workshop that is named My Future Board. This is a graduation. We make a big party for them as a graduation, and they go with social support of their family, their sons, their partners, etc. This is the LGBT parade. As a clinicians, we have to be there because we need to be there to be in their community, for them to feel that this is really matter to us. This is the first Goofy Games in Puerto Rico, was this year. This is a trans fashion. They are participants of our clinic, some of them. This is a night out for a fair. And we have here some of our participants, but also some of the community that is not in, that they are not participating in our clinic, but they engage in different community activities. This is a guerrilla. They mention a guerrilla. It's a war that they call each other and they say, well, we will meet you in this area and we will fight you or challenge you playing volleyball. This is one of our activists that I went with her to one of the radio show to talk about gender identity and how to, as a community, help them to feel beloved. And this is a night activity that was sponsored with, this is the only pharmaceutical company, Gilead, for PrEP. I have to mention the name because they are the only one. That they have educational community liaison that work with us to educate our participants in terms regarding PrEP. And some of them are people of US that are very engaged in our activities, and that's why I want to mention it. Because it's not a local situation, it's a national, it's a world situation. So here you have, in the AIDS Watch conference, 2 of our participants were there, and the clinic coordinator that is in the right area support them to participate in this HIV advocate in the Capitol Hill this year. This is, in the middle is our CEO of the Centro Ararat that is very engaged in this kind of activities to promote educational programs in different conferences and expo labs, etc. With 3 of our transgender community because they already advocate for that. And another presentations in the national transgender community. Our psychologist, myself, one of our participants that is that she is the navigator and adherence peer. And this is the counseling of the LGBT community for the governor. And one of the days that we promoted and make advocates for anti-discrimination law. In the Capitolio, we have the opportunity to have our second Puerto Rico Transgender Health Conference. The first one was, our main speaker was Maribel, and the second one was this year and was with 2 experts from the Buenos Aires. This is one of the presentation of our peer navigator in the tweet convening. And at least, I think that I want to show you that when we want to help, we have to ask the patients or the participants in the community, what do you want? What do you want to do? Where are you going to be? So we are here just to help you, and we enroll them in different kind of activities for them to advocate from themselves, and we are just orchestrating just the foundation for them to be the best as they can. I just want to finish with this. If you cannot fly, then run. If you cannot run, then walk. If you cannot walk, then crawl. But whatever you do, you have to keep moving forward. Thank you.